Hi, in this video, we're going to go through the best stretches for trigger points in the buttocks or the glute muscles. Now, the glute muscles, if you got a lot of pain in your low back and you got a lot of tenderness in the trigger points in the glutes, you want to be able to address those trigger points first. Address them first. Once the pain starts going away, then you can start getting into a stretching program. Now, there's a million different exercises you can do. Now, over 20 years treating my patients, I've just kind of come down to maybe two that you really need to do. And the first exercise is just lying down on your back and bringing your knee up to your chest. Now, this is what everybody usually does, and this is where it ends. But really, in the glute muscle, there's different muscles back there. It's not just one big muscle. There's a wide variety of muscles, and they all go into different directions. So by bringing your knee into one direction is not going to be able to target all the muscles. So then you need to take your knee and bring it a little bit to the opposite shoulder. And then after that, you want to bring it a little bit at another angle and at another angle. So your knee is going to kind of go point like a clock all the way along. And you're going to start to realize you're going to be targeting different muscles in the glute areas if you do the stretch this way. Now, when you do it, hold it for about 30 seconds to about a minute. Sometimes I recommend holding it up to 2 minutes. So I'm always finding that there's a certain group of population that probably need to stretch that muscle for at least 2 minutes. So hold that as much as you can. Now, the other exercise that we have is called a piriformis stretch. And basically, you just sit on the floor, bring one knee over the other, and twist your body, and you'll be able to feel a stretch into that glute area. Now, if this exercise is difficult for you to do, you can also do this sitting in a chair. Just cross your leg a little bit, bring your knee down, and then lean towards into it, and you should feel a stretch in the glutes. Now, another point to remember is when you're doing these stretches and you're finding out that trigger point pain or that muscle discomfort is increasing, you want to stop your stretches. You want to go back into doing the trigger point treatments, do the self-treatments, see how it feels, see if the pain starts coming down, and then go back into stretching again. I've had patients that have gone from trigger point treatments to stretching. It got worse. They went back to trigger point treatments, back to stretching. It got worse. They did that maybe 4 or 5 times until near the end. It actually made a difference. So don't get frustrated that it's not going to work the first time. You got to play around with it, go back to the trigger points, and then gradually work your way into the stretching. If you need to know how to treat your trigger points for other muscle groups or other types of conditions, definitely go to wizardofhealth.net. We got tons of videos and articles there to be able to take you step by step through all the prevention techniques, treatment techniques, stretching and strengthening programs that you need. And we'll see you guys in the next video. Thanks.